Hey, what's up YouTube? What's going on? Back with another video today. And in today's new video, what I'm going to be talking about is why it's important to understand spine biomechanics when it comes to understanding lower back pain and understanding symptoms and ultimately treating your lower back issues or problems. Now, spine biomechanics, I feel, is a field that doesn't give the attention it deserves when it comes to treating someone with lower back pain or just understanding one's symptoms and being able to manage them or treat them appropriately. And a perfect example would be Dr. Stuart McGill himself, who was a spine biomechanist. He was a researcher, he was never a clinician in terms of how he started out. Ultimately, he's a clinician now and he does treat people, but that's not how he started out. And now he is essentially the leading expert in the lower back pain field and treating people. It's his material that is essentially light years ahead of the medical field in treating lower back pain, in my opinion. And the reason for that is just because when we understand and look at spine biomechanics, they understand different joint loads, forces, postures, and how this could affect various joints or tissues when we engage in different postures or movements. So for example, if someone has poor posture or has a poor movement pattern, for example, they have poor technique when they're walking, this could place some additional stress onto the lower back, and over time, if they do not correct this could potentially cause problems, or if someone already has existing lower back pain issues, could make their symptoms worse. And that's one thing I personally look out for, is for movement patterns, how one walks, how one performs certain activities, whether that's maybe squatting, or maybe performing a shoulder press or some sort of overhead activity, understanding how their back may be affected from a lot of these different movements, but at the same time, just looking at someone's posture. Do they have forward head posture? Do they sit in an anterior pelvic tilt? All these factors need to be taken into consideration when understanding lower back pain and attempting to treat lower back pain. Because if we disregard various movement patterns or postures, then we are only going to be limiting ourselves when it comes to treating lower back pain, specifically in the case of a clinician or someone that works with lower back pain. And if we look to a physical therapist, for example, they used manual approaches for treating people with lower back pain. You look to a surgeon, they often look to images such as an MRI or X-ray or maybe a discogram for diagnosing someone with a lower back issue or determining if someone needs surgery. Now, at the same time, if that surgeon or that clinician just relies on medical images, they're right there limiting themselves, and by disregarding any spine biomechanics, understanding force loads and different triggers and why one is experiencing symptoms, they could be advising surgery in a case where someone may not need surgery, or they can advise on a poor conservative treatment or poor conservative approach where they may be just handing someone a sheet of paper with some exercise or stretches to do, or maybe just telling them to do swimming, when that could possibly be triggering their pain to begin with, or that may be their pain trigger and why they're in pain to begin with. So just wanted to make this video to address the importance of spine biomechanics and understanding lower back pain. Because the reason is when we engage in different postures, engage in different movements, these are all going to affect the way that load and stress is placed onto our lower back. And this is important to understand because it's going to help not only in the diagnosis of someone with a lower back injury, but it also helps in the treatment to understand what their pain triggers are and what they need moving forward and what they need to address. So maybe they need to correct some movement patterns, maybe they need to correct some postures, maybe they need some more stability at a joint or a disc that is lacking stability and it needs more stability to hold it up and help build a tolerance and reduce some of the stress and spare the spine in the long run. So those are just a few considerations, and I just wanted to make this video to kind of mention the importance of spine biomechanics because I feel like it's a field that gets underappreciated, and in my opinion, it is one of the most important things to understand when it comes to treating people with lower back issues or lower back pain. Now, biomechanics itself, this could be related to maybe any injury for that matter, maybe a knee, maybe a shoulder, but just specifically staying on the topic of lower back issues, just wanted to kind of talk about that and why the biomechanics is important. Because when you look at the medical field, we look at PTs, when you look at general practitioners, they're not going to school to study spine biomechanics. And that's why they may be limited in the way they treat patients with lower back pain. And that would be specifically because maybe they're not furthering their education in that specific realm to help treat people with lower back pain. And the perfect example is Dr. Stuart McGill himself, who is a spine biomechanist and is essentially now the leading or world-renowned kind of expert, you could say, in treating people with lower back pain. So that's all I wanted to say in this video, and I'm not saying anything against physical therapy or doctors in this video, but the point being is that everything needs to be taken into account. The biomechanics needs to be taken into account. The medical imaging needs to be taken into account. The different manual approaches that physical therapists may use need to be taken into account. And once all those factors are combined, and when they're incorporated together, that's when you get a proper assessment and a proper treatment program can be developed for an individual. Because if one just kind of limits himself or only specializes in one aspect, then they're going to be limiting themselves as a clinician, and the patient they're treating could possibly end up in a worse position because they may not get the right treatment due to the limitations that clinician has from a skill set point of view. So that's all I wanted to share in this video, guys. Hope you guys enjoyed this video. Hope you guys learned something. If you have any questions, comments, please leave them below. And until next time, all the best. Take care.